Good afternoon. According to the Centers for Disease Control and Prevention, in 2011 there were more than 24,000 confirmed and documented cases of Lyme disease here in the United States. My name is Erica Thibodeau, and today I am here to inform you of Lyme disease. I will begin by giving you 3 basic points and then slightly briefing you on them. I will start with the first point being what Lyme disease is. Second, I will inform you on what the symptoms of Lyme disease are. And third, but not last, I will tell you how you can prevent or avoid getting Lyme disease. So having said this, let's begin with the first point. What is Lyme disease? Lyme disease is a bacterial infection that occurs usually after you have had a bite from a deer tick. Usually deer ticks tend to carry this bacterium called a spirochete. If you have a bite from a deer tick and it's untreated, then you will have the bacterium or spirochete attack your bloodstream. If it goes further untreated, it then may go on to attack your body tissues. Having said this, there are minor to major symptoms that may occur from the attack from the bacterium or spirochete. So, what are the symptoms that may occur when you have had a bite from a deer tick? Often there are no symptoms, but if you do have symptoms, they may start with a rash at the site of the bite from the deer tick. Usually the average width of the bite is 5 to 6 inches in diameter. It's usually rounded or oval, has a darker pink center in the middle and a lighter pink outside circular area. Now these rashes generally spread, especially if untreated, and they have been known to be as wide as 2 feet wide. So, what other symptoms exist? Well, there are flu-like symptoms, which should not go unnoticed if you have had a deer tick bite. Most people don't know they have had a deer tick bite them because they are as small as an apple seed or even a poppy seed. So some flu-like symptoms that might exist would be like chills, mild fatigue, fever, body aches. In a more extreme stage though, if this goes untreated, there may be more severe symptoms such as paralysis of the face, numbness and tingling of the extremities, arthritis, memory loss, severe fatigue, and so on. So this can be pretty serious, and these symptoms can last anywhere from weeks to months to a year. But knowing this, there are many antibiotics that are known orally or intravenously that can be provided to help the person depending on the stage that they're at. And even saying that though, let's talk about the preventative measures, because we prefer to prevent this rather than deal with the symptoms at hand. How do you prevent Lyme disease? Well, there are a numerous number of suggestions. Let's see. We have stay on cleared, well-traveled paths. If you are going camping, try not to camp close to the bushes or tall grasses. Use insect repellents such as DEET, particularly DEET, on your skin as well as your clothing. Though DEET is possibly cancer-causing, it's probably better than getting Lyme disease if you're not using it often. Use it in moderation. Avoid sitting on the ground. Avoid sitting on stone walls, as the ground and stone walls actually are havens for ticks and bugs and such. Do a full body check after you have come from hiking or camping and such. And don't only check yourself, but also check your children and your pets, because they are also culprits. I mean, the culprits also get them. Pay attention to your body and the symptoms. If you have had a deer tick incident and you think that you have symptoms of the flu, then you might want to see a physician, really. But in summary, we have talked about Lyme disease, the symptoms, and how you can prevent Lyme disease. Really, in the coming years, since 1975, which is the first year that the Lyme disease was discovered, it has increased. The number of cases has increased incredibly in the United States. So I hope that I have informed you so that you have an idea of what Lyme disease is, as well as the symptoms and how to prevent it. And thank you for your time. And if you have any questions on it, I will give you further information. Goodbye.